Talk show. We set aside some time on Thursday to talk to members of the medical community today. Dr. Karenne Fru is here talking this morning about infertility. We were talking off camera, and I just said to the doctor, she's piqued my curiosity. You said that in some way or another, everybody has been affected by infertility.
Yep, that is absolutely correct. And the reason why is because 10% of all women between the ages of 15 and 44, that's a wide range, are infertile. And 9% of men within that same age range are infertile as well. So everybody has been touched by infertility, even if you don't know about it.
And I said, you really caught me off guard when you said that, to think that everybody is affected in one way or another. When we break it down gender-wise, when we talk about men, I'm going to know this a lot better.
Yeah.
Because I'm a guy. We're talking about just sperm, but when it comes to a woman, are there many different things? Because to me, the layperson, your plumbing seems like it's much more diverse than it is for a guy.
So the problem, when it comes to the problem with infertility, it's about 30% exclusively male, and that's with low or absent sperm, and there are many ways you can get to that. And then 30% of the time is exclusively female. Okay. And the other 30% is male and female, so two people with problems tend to find each other. Yeah. So the male problems, like you said, are largely sperm, but with the woman, it might be that she doesn't release an egg regularly every month, or she releases an egg, but her tubes are blocked, so then the sperm and the egg cannot meet. Okay. Or they can meet because the tubes are open, but then there's a problem with the uterus structurally, like fibroids or a septum, or her cervix is stenotic, so the sperm can't even get through. So there are a lot more things we can do with the women, but at the end of the day, there's male factor infertility by not having a man present, so you are definitely an important part of the equation. It's literally why it's the miracle of childbirth. That so many different ways to do it. Now, because you have said that it is something that pretty much everyone in one way or another has been touched by, is it something, I mean, I know it's treatable, but how treatable is this? Very, actually. We are able to make most of our infertile couples fertile, so that is why we do what we do. And one of the ways to do it is either give medicines or hormone injections in order to treat what the root cause is, and help the woman maybe ovulate regularly. That might be all we need to do. Sometimes we need to structurally go in and repair things so that restore normal anatomy. That's another way we could do it. Or when all else fails, or we've fixed everything and it's still not happening, we can do in vitro fertilization and make sure that the egg and the sperm do in fact meet and develop into an embryo. We can even test that embryo to make sure it's normal before putting it back in the lady. So there are lots of steps to go through before we absolutely give up. It must be, though, your line of work must be so rewarding to see people who come in and think, we've tried and we've tried and we just can't, and then you're able to help them bring a child into the world. Why do you think I have this big smile on my face? It's awesome. I mean, and the work you guys do to do that, it's just, it's great stuff. Well, we appreciate the time this morning. Thank you very much. And she's not wearing the white coat, but like I always say, don't email me because I never wear the white coat. She's gone through a lot more schooling than I do. You always want to talk to your physician if you have questions. We're back after this.